Welcome to Continuing Mobile Education for Emergency Medical Services Providers. This is Communication, Episode 4, Communicating with Residential Care Facility Staff. At the end of this episode, participants will understand the unique environment of the nursing home. They will hear examples of positive and negative communication, and they will gain insight as to how skilled care facility personnel view EMS and their interactions.
There was a time where it went well, actually. There was, when we pulled up, we came for a CHF patient, and there was a doctor in the room when we got there. We were able to go right in, and there was a doctor. She was doing treatments. I think she was giving a nebulizer, and the whole time there was conversation, and there was a team atmosphere. She even knew kind of what to expect from me, what kind of medications I had. We talked about giving morphine, whether she would give it or whether I would give it, and we discussed the dosing. And so there was a whole team atmosphere. There was a lot of people in the room. We were all helping, and we were able to get the patient, who was pretty sick, stabilized and transported pretty quickly, which was awesome.
Well, in general, skilled nursing facilities would ask for an EMS provider to come to the facility when they need one of their nursing home residents transported to an acute hospital care setting, usually for an emergency evaluation. For each facility, the reason that they send somebody might be a little different. In general, a lot of facilities have a variety of medications available. Some facilities even have IV therapies available. But it's not necessarily universal what each facility has, and so the availability of those resources certainly influences what residents go with emergency medicine providers to different sites of care. One of the things that often influences the transfer of residents or the involvement of EMS providers is nursing home staffing. I think there's generally some large misconceptions about staffing that's available at nursing homes. This is another thing that's widely variable, but a lot of nursing facilities have one registered nurse on site at a time, if any, and that registered nurse may not adequately be able to meet all of the assessment and treatment needs of a resident who's acutely ill. And this can sometimes influence the need to call an EMS provider for some help.
A nursing facility may call EMS because a resident needs an emergent evaluation, the appropriate medical therapy is not available, or the condition of a resident may require additional healthcare personnel.
There's several. When you get there, finding the patient, sometimes you go in and nobody knows that an ambulance has been called, nobody knows where the patient nobody knows who you're looking for. Oh, let me go get the nurse, and it takes 5 minutes to find the patient that you came lights and sirens for. That can be pretty frustrating, and sometimes you can find the patient but nobody knows anything about them. Like the staff that are there aren't sure of the medical history, aren't sure why the nurse called, or the nurse isn't there. I mean, and we have to wait to get the story on the patient. So that can be frustrating because oftentimes you aren't able to communicate very effectively with skilled nursing facility patients by, maybe it's hard of hearing, or whether it's the severity of their illness, or either way, we expect to get some sort of report from the staff, and sometimes that's hard to come by. I think also the patients, they tend to be pretty sick, and it's really difficult to communicate with some of them. Oftentimes you don't expect, I guess, to be able to communicate very well with them. And then other times when let's say we've got the patient loaded and they're ready to go, and if they're critical, we have to wait for the chart to be copied or something. That's frustrating because, if it's an emergency, if it was emergent enough to call an ambulance, and then we have to wait for the chart to get copied before we can go to the hospital, that can be pretty frustrating. So I think in general, when they're not ready for us is a source of frustration for EMS.
So I think one of the biggest sources of conflict is what people's priorities are, and that gets reflected out in the communication. EMS is involved in are interested in ABCs, primary survey, secondary survey, address the critical issues that are present currently. On the nursing home side, it's their familiarity and their focus is traditionally much more on functional status, cognitive status, and things like that. And so there is a little bit of a communication gap, and there's a little bit of a priority gap that has to get resolved by close working together between the two groups. I think another challenge potentially is that the nurse taking care of the patient may not know the patient very well, and in most skilled nursing facilities may be covering a large number of patients. And so when EMS goes in and wants to know all this information, the nurse may not know, which would result in the EMT or the paramedic getting angry or frustrated with this nursing home staff, which really isn't fair. Nursing staff has to rotate. You can't have the same nurse there 24/7, and that's going to result in some challenges in terms of knowledge of that patient. I think some of it is also just kind of a approach to the patients. When EMS comes in, we tend to be very matter-of-fact, move quickly, let's get going. While that is our standard, that may not come off that great to somebody else. And so there could also be some interpersonal conflicts because of just the nature of the people that go into EMS and the nature of the people that go into other fields.
Potential sources of conflict include EMS has a different priority set, facility staffing constraints may limit the knowledge of the patient, and bedside approaches may differ between EMS and facility staff.
I think the first expectation is that the EMS provider recognize that even though it's a healthcare facility, it first and foremost is a person's home. And so that's an important conceptual thing to keep in mind. And so we'd expect that when EMS providers enter our home, that they treat all of us with the respect that we would expect in our own home. I think that there's an old saying that says when you've seen one nursing home resident, you've seen one nursing home resident, and that's certainly true. I think that one of the expectations that we have is that providers recognize that each resident may be different in terms of their medical needs, their functional abilities, and what the ideal interaction with an EMS provider is going to be. And so individualization of care and interaction is going to be really important, kind of not formulating a preconceptualized idea of what's going to happen when you get there. I guess I would say that the vast majority of our encounters are very positive interactions with EMS providers. They bring to our facilities a skill expertise that we don't have, and especially in light of some of the limited staffing and limited exposure that our care providers have to some of those realms, we're always very grateful to have our EMS providers present. The interactions that we've had that we feel like have been the most successful are usually characterized by a good two-way exchange of information. And so the things that I would say have contributed to those interactions are good listening, so that when care providers at the nursing home kind of have something to say about their resident, that the EMS providers have really dutifully listened to that and taken it into their own professional assessment. The other thing that I would say was really important was that if they needed something, they asked for it specifically. I think there's some limited experience of a lot of nursing home providers to the actual professional role of EMS providers, and in some cases there's been pretty limited exposure, and so people who are working in the nursing home or living in the nursing home may really not have a good understanding of what EMS providers need to be successful, and I think when people have asked specifically, that's really helped communication be good. On the other hand, like any healthcare system interaction, there's always a few circumstances where you really have seen opportunities for improvement. And I think the situations that have been most frustrating to us are ones where care providers in the nursing home feel like they have valuable information to impart, but that it's not being heard. The other example that comes to mind from my own personal care patients is circumstances where we've had concerns about a resident, for example, if they had significant abdominal pain that was different than their normal scenario. There have been circumstances where we've sent patients like that out to the emergency department for a quick emergent evaluation that we weren't able to offer in the nursing home. I can think of a few examples of en route those people being kind of given diagnostic impressions that markedly differed from the care providers in one facility. And it's not a right or wrong situation, but I think that the resident in those circumstances was kind of caught in the middle, so that they didn't have a good sense of whom to trust or where in the evaluation they were. And so opportunities to really kind of be on the same page with providers in the nursing home have been helpful to us.
I go in with a smile. You know, I think if you start off the interaction positively and go in and try to have a positive, that generally that's what you get back. If you go in with an attitude, you're going to get an attitude back. And so you go in and you smile and you say thanks for everything and you be polite, and instead of demanding something, you ask for help and stuff like that. I think that is like a big would be my biggest advice, and that's what helps me out, I think, is just trying to be pleasant and not necessarily demanding, but asking, and regular old manner stuff.
To promote a positive interaction, treat the nursing facility as a home and treat each patient as an individual. Expect a positive interaction and listen to the nursing facility provider. Always be professional if there's differences in assessment, and be specific and polite if additional resources are needed.
I guess the first message would be that a thank you message. We really appreciate the services that they offer to our residents in getting them promptly to care that they need. The second advice or tip that I would give is keep in mind that nursing homes are becoming very specialized sites of care, and so while we really strive to give the best care possible there, we're really kind of micro-specialists in our own environment. And as such, we kind of hope to be treated with the same respect that any other healthcare provider would be. I think we all have the same goals as a team, and so if there's ways that we can help you, please let us know.
At the end of this episode, you should understand the nursing home environment is unique, and understand how to improve your communication with nursing home providers. And you should gain some insight into how skilled care facility personnel view EMS and EMS interactions.